Hello and welcome back to my YouTube channel, Med School Moaz. In this video, I will be looking back on my academic journey and telling my story. My YouTube analytics tell me that most of my audience are high school students, so I'm going to be speaking specifically to you guys that are interested in going through medical school to become doctors. My purpose is to help others through the themes of empathy and being restorative, while promoting honesty and passion. This ties back to my academic and career journey since due to the difficulty of the biomedical major, a student needs real and powerful motivation to push through their academics. I've always wanted to help others, and being a medical graduate opens the pathway to do so in a great way. Medical school is very difficult, and students need to have the passion and honesty in their attention in order to succeed. The educational pathway I took to become a doctor is very important to me because of how long and arduous it is and how important the knowledge and certifications I earned are to my degree. I went to high school at Lake Buena Vista High School, where I spent the first 2 years taking general high school classes. After that, I applied to my high school's Valencia College dual enrollment program for my junior and senior year. After taking the PERT exam, I took my first semester at Valencia College during the fall of 2022. During my time at Valencia, I enrolled to take a class called New Student Experience. This class helped me with my introduction to college, my academic future, and helped me confirm the medical field was my desired career path. Also, this class allowed me to become familiar with all the student resources Valencia had to offer. Taking advantage of these free resources allowed me to become more successful. Using the advising center, I was able to meet with my counselor and review my educational plan for graduation and discuss all the options available to me. Also, the library is where I would visit most often in order to work on my assignments and find a quiet study area. The library helped me stay focused on my goals and prepare for exams. During this time, I was still technically a high school student, so my first 2 years of college, or my AA, were paid for by my local county. I finished my 60 credits for my AA at Valencia soon after graduating high school. After graduating Valencia with my AA, I transferred to the University of Central Florida to pursue my bachelor's degree in biomedical sciences. Before transferring to UCF, I studied hard for the SAT and kept my GPA up. Because of this, I was able to apply for Bright Futures 100% coverage, which had a requirement of a 1330 SAT score and a 3.0 weighted GPA. Bright Futures covered my first 5 years of UCF education, and I was able to pocket any other scholarships earned. The cost of my first undergraduate education at UCF was $13,336, which was covered by Bright Futures. After graduating with a bachelor's in biomedical sciences, I applied for UCF College of Medicine. Thankfully, I was admitted, and I spent 4 years in medical school. I graduated with an MD and a physician board certification. After that, I undertook a residency program during which I received additional training in advanced diagnostic techniques. After completing residency, I obtained a license to practice medicine. Now let's talk about the actual career. I started my first job experience after graduating shadowing a primary health care physician at Advent Health. I then obtained a position as a practicing physician myself. My position as a physician had me working to diagnose and treat medical illnesses, injuries, and conditions in my patients. Some of the duties I engaged in as a physician are performing comprehensive physical examinations to evaluate patients, recording patient histories in paper or electronic patient records, ordering blood, urine, and tissue sample tests, imaging and radiography, and other diagnostic tests that are required, interpreting test results to make diagnosis, working with a team of healthcare providers to create an appropriate plan for treatment and therapy, prescribing medication, medical assistance devices, addressing patient concerns, and counseling patients about illnesses and conditions, and guiding them towards further therapy if indicated. Performing procedures including minor surgeries, setting broken bones, and stitching wounds. Attending conferences, meetings, and continuing education events, and taking part in research and clinical studies. The main workforce skills needed in order to complete these tasks are communication skills, problem-solving skills, and decision skills. I'm very lucky to have the opportunity to pursue my passion in the biomedical field. Thank you all so much for watching. If you liked the video, make sure to press the thumbs up button, and if you're not a fan, let me know with a thumbs down. I post new videos every week, so make sure you're subscribed with the notification bell enabled. See you guys in the next one.